Hello, everyone. My name is Antonio Chavez Hernandez, and welcome to Arizona News. Today, we are going to be reporting an ongoing outbreak of Lassa virus. Before we get into the current outbreak, let's give you a brief overview of this virus. The Lassa virus showed cases originating back from the 1950s. However, it was first classified and confirmed as Lassa virus in 1969 from a case that occurred in Lassa, Nigeria. Infected rodents, being the natural reservoir, are known to be the common route of infection for this virus. And currently, there is an ongoing outbreak that is reporting 963 lab-confirmed cases and 188 deaths, making this a large threat with around a 5.12% case fatality rate. I'm going to pass it on to Cecily to discuss transmission routes and symptoms. Thank you.
Hi, my name is Cesily and I'll be talking about transmission and signs and symptoms of Lassa virus. The host of Lassa virus is a rodent known as multimamante rat, and when this rat becomes infected, it can excrete the virus for a long time period and possibly for the rest of the rat's life. These rodents breed frequently and colonize human homes and areas where food is stored. Transmission usually occurs through ingestion or inhalation, and the rodents shed the virus in urine and droppings. When you are in direct contact with the materials, either through soiled objects, eating contaminated food, or exposure to open cuts or sores, this can lead to infection. Contact can also happen when a person inhales tiny particles in the air that were contaminated, and usually this happens when people are sweeping and dust just flies everywhere. That's when people can get infected this way. Person to person transmission may also occur after exposure to the virus in the blood, tissue, secretions, or excretions of Lassa virus infected people. Just to go over some signs and symptoms that we should be aware of is after you come into contact with Lassa virus fever, signs and symptoms tend to occur 1 to 3 weeks after. In approximately 80% of Lassa fever infections, symptoms are mild and undiagnosed. These symptoms include slight fever, weakness, and headache. And in 20% of infected individuals, symptoms are much more serious, which include hemorrhaging, respiratory distress, repeated vomiting, facial swelling, pain in chest, back, and abdomen, and also shock. There has also been neurological problems that have been associated with this virus, such as hearing loss, tremors, and encephalitis. Within 2 weeks after symptoms have onset due to multi organ failure, death may occur. Thank you, and I'll hand it off to Isabella for prevention.
Thank you, Cecily. I'm Isabella reporting out of office, and I'm here to tell you how you and your family can prevent yourself from getting Lassa virus. Since contact with rodents is the main way Lassa virus is transmitted, putting away food in rodent safe containers and keeping houses clean is the best way to discourage rodents from entering your home. In addition to this, if you happen to be taking care of somebody who's been infected with this virus, taking precaution to prevent transmission should be utilized, which would include using gloves, masks, goggles, equipment sterilization, and isolation. Lastly, educating the public on how to lower the risk of rodents entering your home is also an effective strategy. Since research is still developing a vaccine to fight against Lassa virus, these are just some steps you and your family can take to keep yourself safe. Now, on to how this correlates to the One Health concept.
For the One Health aspect of Lassa fever, the leadership and commitment and investment is needed in order to build an integrated and effective community of One Health surveillance, as well as a rapid response approach. This could all be done with pest management and phytosanitation measures against Lassa fever epidemic. Having this offers new opportunities in understanding human animal interactions in strengthening the Lassa fever outbreak, and early detection and surveillance would provide warning by providing warning alerts and rapid response implementation in vulnerable settings. Therefore, it is all important to pay attention to the effects of power and politics on science and policy, and to ask whose world is being defined by whom and how.